Good afternoon. I have good news. As of today, there have been 52,021 Paycheck Protection Program loans approved for small businesses throughout the state of Florida. The total amount of that is $12.5 billion. That's an unprecedented sum. The money has not been distributed yet. The feds are working on that, but everything's teed up and ready to go. And I think that will be a really important lifeline for Florida's small businesses who have really been hit hard by this downturn. We also have another exciting announcement today in the realm of PPE, the personal protective equipment that is so important for our first responders and our healthcare workers. Today, in consultation from the White House, we have received or will receive a total of 1 million N95 masks. Those are probably the most sought-after piece of PPE right now. There's obviously been a worldwide run on that. Working with the White House, they've earmarked us 1 million. We have 800,000 of that shipment in hand. Jared Moskowitz, the head of the Department of Emergency and Management, is deploying that 800,000 masks to our frontline hospitals and healthcare workers. I want to thank the White House for their responsiveness. When this all started, we had millions of these masks ordered. We would be told they would be delivered on Friday. Then you'd go and they disappear. Oh, next Wednesday you go, they disappear. It's been a real problem how the secondary markets work, but I'm glad we were able to work this out with the White House. I've also been in contact with the CEO of 3M. Now, they don't usually distribute. They have distributors, but he has pledged his support so that we can continue to get the PPE that Florida needs. So I want to thank the CEO of 3M for being responsive to our concerns. In addition to those masks, Florida's Emergency Management Department will be making a delivery over the next 36 hours of even more PPE. This delivery will include another 1.2 million procedure masks, 100,000 face shields, 500,000 gloves, 60,000 containers of hand sanitizer, 35,000 gowns, which those are very much in need. So with this push, the state will have distributed 8 million masks, 5.5 million gloves, 564,000 shoe covers, 615,000 face shields, 300,000 gowns, more than 100,000 containers of hand sanitizer, 47,000 goggles, and 22,000 coveralls. So that is a massive amount of equipment. It's more than the division has ever done in Florida's history. Very complicated. There's been a worldwide run on all this stuff, so I want to thank Jared for his good work. And I want to thank all the truck drivers, all our National Guards men and women, and employees at the Florida Department of Health and Division of Emergency Management. They're working 24/7 to efficiently move these critical resources throughout our state, and it's very important for the work that's being done. We have great news yesterday, an announcement about our National Guard strike teams. They had been doing this periodically throughout the nursing homes. It was very effective, so we wanted to expand that. So we have 10 teams of 4 soldiers each. They're actively testing. Today, they've already taken samples from 500 people, and there are going to be many more. And I've told Jared we want to expand that as widely as we can. It's very important that we focus resources on those people who are the most vulnerable to COVID-19. And so I want to thank the National Guard for really leading the effort on this. We had done a lot early on the screening and on limiting the visitation, and that has been effective. I mean, there were definitely people who were sick who were kept out. The problem is with the staffs, not everyone has symptoms. So you have one staff member who's not symptomatic, and they can infect 10, 20 other staff members, and obviously that could transfer over to the residents. And so doing this spot testing is a way to be able to identify that and then prevent a major outbreak in one of these facilities. Testing has been a big priority in the state of Florida. We've tested over 204,000 individuals in terms of raw numbers. That is number 3 in the country. By the end of today, we probably will have about 210,000 results in. That's close to 1 in every 100 Floridians. Now, you look at some of these other countries, I mean, very advanced countries like Japan, look at how many they tested vis-a-vis their population. So this is a very good ratio. We're going to do even better. Southeast Florida, if you just look at those 3 counties that have had the most cases, 60% of our cases, we're probably in the range of 1 test for every 85 residents in Miami, Broward, and Palm Beach counties. And again, that's something that's very important. So we've been able to get a better baseline about what's happening. Obviously, people want to be able to get tested and get results, which is very, very important. Some of these countries, Japan, didn't even do close to this much. South Korea had done 1 in every 200. When this all started, people said, oh, if you can test like South Korea, then you're going to be able to get COVID-19 under control. So we are continuing to focus on it. We announced last week we're going to continue the 3 sites in Orlando, Jacksonville, and Miami. The federal government was only planning on doing them through April 10th. I think they've been popular. I think we need to do more. It's important that those criteria has really expanded from the start of this. Anybody with coronavirus symptoms can go to one of those sites. Any healthcare worker, any first responder. If you don't have symptoms, but you've had close contact with somebody who's recently tested positive for coronavirus, you can go into those sites. And that, I think, is really, really important. And then it also brings up kind of when we get out of this phase and then get into the next phase, what is it going to look like in terms of testing? And I think there has to be an easy way for somebody, if you have a small business and you have 20 employees and someone's coming up with symptoms, to be able to go get a test and get an answer in a reasonable amount of time. So we're working on what that would look like. I've got folks working on a committee to see what we can do to make this testing even more prevalent. Obviously, things like the Abbott Labs test, which is a 5-minute test. The hospitals, many of the hospitals have them. They're churning out about 1,500 to 2,000 of the individual cartridges and sending them to each hospital a week. We obviously, we will buy as many as they have, but there's obviously a crush on that. So that may be part of it, but even if it's the traditional swab with the lab test, you can get the lab test turned around quicker. Then I think people can deal with that. It's just if it's 5 or 6 days, then it becomes much more difficult. And so we're thinking about how do we leverage the infrastructure we've already put in for kind of a phase 2 where we're having more activity in society but still have to identify who is infected, isolate them, and then trace the contacts, and so you don't have an outbreak in some of these communities. And so we're hoping that we're going to be able to do even more very soon. If you have the baseline for testing, the ability to be able to do things, I think, increases dramatically, and it's very, very important. The travel update, we've screened almost 20,000 people coming from the New York City area and from New Orleans, mostly from the New York City area, obviously the top hot zone in the world, and the requirement to self-isolate. I think that's been effective. You don't have that many people coming from that part of the country and not have massive outbreaks unless you're doing something. And so I think that was the right thing to do, and I think that it has been effective, and I'm glad that we were able to do it. If you look at the case total and what's going on throughout the state, we continue to see the bulk of the cases in the 3 southeastern Florida counties, Miami-Dade, Broward, and Palm Beach County. They represent about 60% of the total cases, more than 60% of the hospitalizations. And so we're obviously working with all those folks, continue to work with those communities. I spoke with all 3 of the county mayors today, not only about how things are going, what more we can do to help, but then they're thinking about the next phase of this as well. What does that look like in Southeast Florida? Is that going to be different than other parts of Florida? We'll see. So we're starting to work through and really think about that. When this all started, when the president and the task force came out in the middle of March and said you need to do 15 days to slow the spread, And there was a whole bunch of different measures, mitigation measures, and we had obviously done things, even some of the things before that with the elderly and whatnot. And then there were other things that were new in there, but it was obviously a big change for society in many respects. But the reason why they did it, the reason why mitigation measures were put in place, was to flatten the curve so that we had enough health care resources to be able to treat the people who would be infected by COVID-19. And the fear was at the time, if you didn't do mitigation measures, then the people that would be going into hospitals would overwhelm the hospital system, and obviously you would have fewer resources to treat COVID patients, but then all the other patients, if that system buckled, would not get the medical care. And so that would be, a disaster if that were to happen. So that was the number one reason to do this. So here we are now, probably a month later. The bed availability throughout the state of Florida is about 42.5%. To put that in perspective, you go back at the end of February, beginning of March, in counties like Dade and Broward, their bed availability was probably about 12% at that time. And so we've dramatically increased capacity in terms of bed availability in the hospitals, and I think probably so much so that you're starting to see healthcare workers who work in other parts of the hospital or healthcare system, get furloughed. And so that's something we're going to have to contend with, because you're not doing elective surgeries. There's a lot of things that aren't going on. But we're at 42.5% availability throughout the state. Different counties, a little different. You have 42% available in Miami-Dade, about 41% in Broward, 46% in Palm Beach County. So that has been stable. We haven't seen very much change in that. I think it's been pretty steady as she goes. That obviously is going to be one of the key indicators in terms of what's happening in the state of Florida. So we want to thank everybody who are working in those hospitals for all the great care they're giving to folks. We are offering updates on our fight for COVID-19, and so if you are interested, you can text FL COVID-19 to 888-777. There'll be periodic updates about what's going on, if there's a new testing site open, if there's something else that's been done. And again, that's Florida COVID-19 to 888-777. I want to thank everybody for all their hard work. I think progress has been made. I think a lot of communities are doing really good. We really appreciate everyone for what they're doing. I'm going to let Jared say a few things, and then we'll take a few questions.
Thank you, Governor. Before I talk about what the division's been working on, I just want to continue to thank the doctors and the nurses and all the folks in the hospital that have been on the front lines. I mean, not only obviously are they dealing with COVID-19, but they're also dealing with the situation in which there are loved ones in these hospitals that can't be visited by their family members because of how this virus works, and they're the ones who are also having to help them through that process. And so I think we should just recognize that it's not just the medical attention that they're performing an emotional function as well because of how this virus works. And so I just want to thank again all the doctors and all the nurses and all the hospital workers for everything they're doing. They really are the true heroes of what's been going on. As the governor talked about, based on the push of PPE today, that'll take us to 8 million masks, 5.5 million gloves, 564,000 shoe covers, 615,000 face shields, 300,000 gowns, over 100,000 containers of hand sanitizer, 47,000 goggles, and 22,000 coveralls, which are basically like Tyvek suits. And so we are continuing to push out all sorts of different PPE. Obviously, burn rates continue to change. We're continuing to analyze that as we decide where it needs to go. But this is a 24-hour operation. We run stuff all night, all day, and we're pushing directly to where it needs to go, directly to the front lines, directly to the hospitals, the nursing homes, and into our first responders, police, and fire. And so. Yesterday I talked about how this is a 50-state disaster. It's the first time in U.S. history that we've had a 50-state disaster declaration. I want to thank the governor for sending a letter to the president asking for 100% reimbursement As many of you know, obviously because we deal with this with hurricanes, when we get a disaster declaration, it starts out at 75% reimbursement, 25% local cost share. And so this is not a state disaster. This is a national disaster. And so I want to thank the governor for requesting that of the president, because that's a big deal. That's a big deal to these hospitals. It's a big deal to these cities and counties who, let's not forget, have dealt with 4 years of hurricanes here. And so that is definitely needed. And the division is still functioning in its regular daily activities. So even while we're doing the COVID-19 response, we are still getting money out the door, because we know as we get into hurricane season how important it's going to be to these cities and counties for reimbursement, as they analyze what sort of lost revenue they may have from COVID-19. Testing. We continue to expand testing. I think the governor will have additional announcements this week. We are working on expanding testing in a number of different areas, a number of different neighborhoods, even changing kind of how the mode of how you get tested, whether that's a walk-up versus a potential drive-through. So we look forward to the governor's efforts on that and leading, and we appreciate everything he's doing. And so, again, it's social distancing. The mitigation measures are working. We are flattening that curve. Florida has a good story to tell on what's been working, and so we have to stay the course. Remember, April 30th is the 30 days to stop the spread, and so even while we talk about the good news that is happening here in the state of Florida, we still need people to continue the social distancing, and we're mindful that there are still many families out there that are suffering with this and have loved ones in hospitals. And so, as we talk about that good news, we're not turning the page on anybody. And so it's important that we continue to focus on the folks that are dealing with COVID-19. So, Governor, thank you.
Yes, sir.
Governor, from one end of the state today, Fort Myers to Jacksonville and everywhere in between, everyone's getting questions. The stations about unemployment. The website's still crashing. The phone's not being answered. Is this a crushing?
Well, I'm not sure now. I mean, so we now have over 1,000 people answering the phones. We pulled the thing about the wait times. I mean, that has improved dramatically. We're getting huge numbers of people through the PEGO website. That obviously is going to be migrated through the Connect system, which it's got to do the verification of Social Security, all these other things. I can also report that the first federal checks are going out today, so people are going to start seeing that $600 federally, and we're going to, and I said, get those in the hopper and get those out. So there's going to be a priority on doing that as well. So you're in a situation where people are now going through this PEGA site. I think that's probably the best solution. Of course, there was 60 servers brought in. There's a whole bunch of things done. So I think that there's a way to migrate that through, process that, and I talked to Lawson today, and I said, we want to turn this stuff around. It usually takes 3 weeks. I said we got to do better than that, because folks are going to be going to be looking for the support. So and then we're having even more folks from all these other agencies. We've identified 2,000. You've had a number of them have come in. They're doing things, and we've gotten paper applications because of the FedEx thing. So you have people that are processing those. So you take an agency, and this has been like a dramatic increase, and so I think it's something that's very important, and it's something that we're putting an awful lot of effort into.
Governor mechanism. Gates had put up a tweet that said that you were working on a program to auto-enroll some of these people that have been laid off, en masse. Disney, the 43,000, Universal Studios, might be a way to actually get them in faster than having to apply. I don't know if you can expand.
Yeah, so basically, we got the notice with Disney that they were going to furlough like 70,000, and they had been paying them through March and early April, but I think that's coming to an end sometime this week or beginning of next. And so we basically said, okay, this system's getting crushed. So we know this is coming, so is there a way we can get a hold of it, maybe get the data directly from the employer, and then go ahead and put it through? Because we can put it through at like 3 in the morning and stuff when there's not other people doing it. So I think it would make sense. I think it would probably be easier for everyone. Now, they wouldn't get any special place in line. Like whoever's applied, is going to go through that way. But I think when you're going to have a massive amount of people from one employer, and that's announced, if we can work with them to get that information and get it through the system, I think that will probably be better for everyone. So yeah, we're open to doing that. We're working to try to do it.
There are some people that are out there that have been, repeatedly still trying to access.
We've had, if you look, we have now had I mean, we've had hundreds of thousands of successful submissions, so there's a lot of this is being processed. There's been an extraordinary amount of man-hours that have been put into it. We deal with it every single day, prodding for improvements any way we can. So I think the federal money, you're going to start seeing that today. You're going to see more of that. I said I want to clear this out as quickly as possible. The federal is actually going to be a hard check that people are going to get. The state portion, which is obviously smaller, can be either direct deposit or a debit card. And so there's going to be kind of different means in terms of that. But the federal money will be a hard check.
Because some people say they're being denied
Who's that?
benefits. Gig workers.
So gig workers, I don't know if they qualify under Florida's existing law, but they do qualify for the $600 federal. So that is absolutely.
Yeah, but how are they going to get that money because if they're denied state?
No. So I just talked to Lawson about it today, and so when you're processing it, there may be certain groups where there's a different calculation. So they understand that, and they understand that the gig workers do qualify for the $600 federal money. Why they did it through the state unemployment system, I will never understand that. It just seems like you're adding additional bureaucracy to this, but that's what they did. So that's what we're going to end up doing.
If you want,
people are applying through it, and then they get it processed. So that's what. So there's you have the gig workers, obviously the traditional unemployment people that qualify in the state will qualify. The federal is more liberal than what the state is, and so there may be people that get the 600 who don't get the other. I think most people in Florida are going to get both, but there may be some that do one.
Do you believe that the president has the authority to order the states to reopen? And have you spoken with neighboring states about trying to get a regional approach to the eventual reopening? And what do
it's interesting. I watched the briefings, and you go back a week or two, and he was being badgered by the press there for why aren't you shutting down these states? South Dakota doesn't have stay at home and whatever. And they were badgering about it, and he said, no, it's their decision. Now they're saying you don't have the. I don't know if it's one or the other. I mean, I think functionally, here's the thing. So when they extended the guidelines, a state did not have to continue with mitigation. Like the state could have done their own thing, but practically speaking, once that happened, you were just not going to be in a situation where you were going to, quote, open up. I mean, that was just the reality. So yes, he could get rid of the guidelines. Does that mean a state has to follow exactly? But what's going to happen is you are going to have people start to move in that direction. And so just as the extension, I think, led to the continued mitigation, if he decides to lift that or do more liberal guidelines, then I think you're going to see the states inevitably follow, because once one or two states does it, the other states are going to kind of be at a disadvantage. So, but I will say this in terms of the state's authority. Just because there's an emergency, that does not give a governor unlimited authority. And you see some of the things that's going on throughout the country. You have people driving in a drive-through church service. They're not leaving their car. They're not coming into contact with anybody. They're turning on the radio. They're listening to a sermon, and they're getting fined by the government. I don't think that's acceptable. I mean, I don't think that you cannot deny someone a constitutional right if what they're doing has no impact whatsoever on this infectious disease. And the fact of the matter is, if someone drives their car, sits in a parking lot, listens to the good news, and goes home, that has zero impact. So some of this stuff, I think, is petty tyranny. I think it's been a huge mistake. And what we've tried to do here is respect people. Obviously, there's a lot of inconveniences with this situation we find ourselves in. But to do things like that, I think some governors have definitely overstepped their bounds.
That's it. Okay, somebody else.
Yes, sir.
Governor, I do have a question to the bridge loan program. Some people are frustrated that it's going away after it reached out its max amount of, I think, $50 million. Any thought about expanding that? Why or why not?
Well, we're looking at the options. I know there's some options with SBA, but look, the people that are going to who have gotten hit the hardest with this are folks who are more blue collar in some of the blue collar jobs, some of the service jobs. Those are not necessarily people that are making $250,000 a year. Many of those people work paycheck to paycheck. And so they're going to need to be able to get on their feet. Hopefully that means that we'll have a light at the end of the tunnel where they have a job to go back to. But these small businesses who employ a lot of people in Florida, I mean, for all the talk about the Disney and this type of company, most of these people are working for small and medium-sized business. The small businesses have taken it on the chin. And so I think that we went for the $50 million bridge loan very early. The PPP loans, the federal loans, Paycheck Protection, I think that that's been very popular. Hopefully that will end up making a big difference. I think they're going to do round 2 on that, which will be important. And then we obviously will see what we can do. The way I view it is some of these businesses, if they don't have the ability to just get through this period financially, may never come back. And I think that would be a loss for the state of Florida.
Called on you to continue keeping schools distance learning through the end of the year. You said, I think last week.
We've talked about it. Like, we haven't made a decision yet. I mean, obviously, it's going to be based on safety. It's going to be based on consultation with folks and the superintendents, the parents. And so we're just in a situation where, we've got to see where we're going. It doesn't mean that they are going to go back, but I think we just need to get down this road a little bit further. And part of what we're going to be doing, and I'll be announcing probably this week, we're creating a task force on what the phase 2 looks like. What does a reopening look like? And they're going to deal with issues like education. It's not just going back to school, at the end of May for a couple weeks, talking about what's the fall semester going to look like for K-12? What's it going to look like for our universities? What would need to be in place? I mean, we're assuming, maybe there'll be an antiviral developed. We don't know how this thing is there going to be this wave and then a second wave comes back in the fall? So there's a lot of things that you need to be prepared for. So they're going to look at all this stuff with education. They're going to look at all with different sectors of the economy. What does a restaurant look like? Kind of in this era going forward? What are some of the other things that people kind of took for granted? I mean, some of the things that have been done throughout the country, closing the gyms. I mean, that's kind of like a textbook thing CDC recognized. And I get like you could get germs and stuff, but I also understand the number one group of people who have been susceptible to COVID-19, if you look at New York and some of these other, obesity is like the number one factor in whether you really get hit hard by COVID-19. And so my fear has been kind of in the last month and continue going, I wonder how the physical activity has been. We got to figure out a way to get people to be able to, enjoy the outdoors, to be able to get out of the house, to be able to get to. So there's a whole bunch of things. It's not just this business or that. It's the education. It's the quality of life. It's exercise and health, mental health. Some of the things that are going to be growing out of this. Well, one, we don't know for sure because this has really never been tried in modern America before, but there are obviously going to be second-order effects, and those are going to be things that we're going to have to deal with here in the state of Florida.
When you're going to decide that?
Hospital to the medical and nursing home communities, they've asked you.
We're looking at it. Yeah, I mean, I haven't made a decision on it. I know that some folks asked me about that. I think it's under review. I haven't made any decisions yet on that. So. It's under review. I haven't made any decisions on it, and we'll look. I know New York did it, and some other states have done it, but we haven't made any decision yet here. So.
Other types of business for exemptions to essential businesses. You've given WWE, for example, the ability to function.
So as people, that Disney asked to have some of the gardening people be able to go because they have all the millions of dollars worth of stuff there, and it would just go bad. And then we said, okay, is there going to be social distance? Yeah, people are going to go out and work themselves. Obviously, WWE, there's no crowd or anything, so it's a very, very small number of people. So we just kind of look at it on a case-by-case basis. We haven't had a huge amount of requests. I mean, so I think a lot of this will just be, what do we look like in May with some of this rather than being able to do stuff. Now, the one thing, though, I do support is I think that we do need to support like content, like especially like sports and events. And we're not going to have crowds there. I get that, but if we can do like if NASCAR does a race and can televise it without having large crowds, I think that's a good thing. I'd like to see Woods and Mickelson do the golf or whatever, because that's social distance. You wouldn't have a gallery there, you wouldn't have crowds, but to put that on TV, I think people have been starved for content. I mean, we haven't had a lot of new content since the beginning of March. Here we are now, or the middle of March. Here we are, the middle of April. And if people are, being told to stay closer to the house, it sure does help to have some fresh things to be able to do. And I think people are chomping at the bit. I mean, if you think about it, we've never had a period like this in modern American history where you've had such little new content, particularly in the sporting realm. I mean, people are watching. We're watching like reruns from like the early 2000s, watching Tom Brady do the Super Bowl then, which is neat because he's going to be in Tampa, and I think they got a chance to win a Super Bowl this year. But I think people to be able to have some light at the end of the tunnel, see that things may get back on a better course. I think from just a psychological perspective, I think is a good thing. So.
Thanks, everybody. Thank you.